Welcome to Section 7 Child CPR. In this section, you'll learn how to respond quickly and confidently when a child isn't responding and isn't breathing normally. First, make sure the area is safe for both of you. Then call to the child in a loud voice and gently tap or touch them to see if they respond. If there's no response, open the airway and check for normal breathing. Look at the chest, listen at the mouth, and feel for breath on your cheek, but only for up to 10 seconds. If the child isn't breathing normally or they're only gasping, that's the moment you start CPR right away. A simple way to remember the rescue sequence is DRSABCD. Danger, response, send for help, airway, breathing, CPR, then defibrillation. If someone else is with you, send them to call 000 and get an AED while you begin chest compressions immediately. Place the child on a firm, flat surface, then kneel beside them so you're lined up with the chest and ready to press straight down. Set the heel of one hand in the center of the chest. If the child is larger and you need more force, you can use two hands instead. When your shoulders are over your hands and your body feels balanced, it's much easier to press effectively and keep each compression steady. Press down at least 1/3 of the chest depth. In a child, that's about 5 centimeters, so each push needs to be firm enough to move the chest. Keep a steady rhythm of 100 to 120 compressions a minute, and let the chest come all the way back up after every push. If you're trained to give rescue breaths, use 30 compressions and 2 breaths. Health professionals who aren't familiar with pediatric basic life support should use that same 30-2 pattern. After 30 compressions, open the airway again with a gentle head tilt and chin lift. Then give 2 rescue breaths. Each breath should take about 1 second and be just enough to make the chest rise. If you don't see that rise, reposition the airway and try again. Keep going with cycles of 30 compressions and 2 breaths until help takes over. The child starts breathing normally, or you're physically unable to continue. As soon as an AED is there, turn it on, attach the pads, and do exactly what the voice prompts tell you, while CPR continues with as little pause as possible. For assessment, you'll need to perform at least 2 full minutes of uninterrupted child CPR on a mannequin, following current ARC requirements from start to finish. That means the assessor is watching the details as you work. Safe setup, hands in the center of the chest, correct depth and rate, effective breaths, and pauses kept as short as possible. So if that moment ever comes, remember the order. Make sure it's safe, check for normal breathing, and if the child isn't breathing normally, start CPR straight away. Use 30 compressions and 2 breaths, and keep going until help takes over or the child starts breathing normally. The reason every second matters is simple. What you do in those first moments can keep them in the fight until help arrives.